Mr. President, there's a final concern, and this really concerns me. It goes to America's seniors. Now, we've made some very strong commitments to our seniors through the Medicare program. Our seniors obviously are more susceptible to needing health care. They have a greater number of health concerns than younger Americans. And we have said to them, we will, through Medicare, ensure that your health concerns will be taken care of. They're obviously very concerned about rationing if Medicare were somehow to be cut in order to raise money to solve the problem for others in our society. And that is precisely what at least one of these bills proposes to do. Cut Medicare and take that money, apply it to the new costs that we are going to be incurring as a result of this so-called health care reform. Seniors are worried that these cuts in Medicare will adversely affect their ability to get care. And they also fret that adding the 47 million uninsured Americans, which would be just for starters, to health insurance rolls, including government insurance rolls, would impact the care that they now receive by crowding the system. In other words, leading to wait times, rationing for them, or even potentially denial of care. We must not implement a new health care system that would suddenly erode the quality of care for Medicare beneficiaries. My constituents want high-quality, patient-centered health care. Most already have good health insurance for themselves. They're concerned about its cost. They're also concerned that there are some who need to be insured who are not. But what they want to hear are fresh new ideas about how to achieve this result without, in effect, throwing the baby out with the bathwater, without adversely affecting the system that currently takes care of them, whether it's seniors being cared for in Medicare or it's the vast majority of Americans who are already insured and like the insurance that they have. They don't want us to rush a costly new plan through the Congress. I think the President was correct when he said if we don't do this quickly, we might not do it at all. What did he mean by that? In effect, what he was saying is, if the American people have a long enough time to study and debate exactly what's being proposed, they may not like what they see. And, Mr. President, I think that's exactly what's happening here. You have a bill that's going to be marked up next week in the House of Representatives, and I don't think the American people are going to like what they see in that bill. You have a bill that has been marked up in the Help Committee here in the Senate, and much of my criticisms here go to that particular bill. There's one section in that bill, for example, that spends $400 billion over 7 years to subsidize health care for families making between $66,000 a year and $80-some thousand a year. Now, is that what we want to cut Medicare to pay for? As I said, the more Americans understand the details of these bills, the more questions I think they're going to ask. And we owe it to our constituents to allow them the time to understand it and to ask us those questions. And I want to be able to go back to Arizona and say, all right, here are the 3 bills or the 2 bills or however many there are. Here's what they do. Do you like it or not? If not, how would you change it? We need the time and the ability to get the reaction from our constituents if we are going to be true to our position as representatives of the people. So when the President says if we don't do this quickly, we might not do it at all, he's probably right. But it's better to get it right, to take our time to do it right, and not make mistakes than to rush something through that's going to add $1 trillion in new spending, that's going to potentially impact the coverage we already have, potentially impact Medicare for our seniors, and perhaps not achieve the results that we want. This is one of the most important things that this Congress will, that the American Congress will have done in years. It's complicated, it's hard, and we've got to get it right. The admonition of a physician, one of the first things you learn in medical school is when you confront a patient to see what's wrong with that patient and to begin the treatment, first do no harm. It's possible to do harm to a patient. And the physician, first of all, is admonished. The body is a wonderful thing. It recovers pretty well. Don't do anything to harm. And the same thing is true with our economy and with the policies with respect to health care. There are a lot of good things being done in health care. Physicians are working very hard to take good care of us. Most people have good insurance. Seniors rely on Medicare. Let's not do harm to what we have in order to take a small segment of our population and make sure that they can get insurance. That's the primary position that we're taking here when we say, let's don't rush this, let's do it right, and at the end of the day, we can all be proud of the fact that we had reformed our health care system to reduce, not increase, some of the expenses and to ensure that those who don't have insurance can, in fact, be covered.